Hi, my name is Sonja Shotwell, and today I'm going to take a few moments to talk with you about medication errors, which is taught in the Nursing 330 course titled Law and Ethics for Healthcare Professionals in the University of Mount Olive RN to BSN program. This video is an assignment for my Master of Science in Nursing degree program at the University of Mount Olive. I have 3 goals and objectives for this brief lecture, and they are to define medication errors, identify potential causes of medication errors, and identify the 6 rights of medication administration and how to apply them. Let me give you a brief overview of our topic today. Medication errors are defined as any preventable event that may cause or lead to inappropriate medication use or patient harm while the medication is in the control of the healthcare professional, patient, or consumer. According to the Food and Drug Administration, they report that more than 100,000 medication errors occur each year. Causes of medication errors could include distraction by the healthcare worker, errors involving miscalculation or ordering, and omitted doses or doses given at incorrect times. Medication errors are serious and could potentially lead to adverse outcomes, including hospitalizations, birth defects, disability, and even death. Medication errors are preventable. Utilizing the 5 rights of medication administration every time a medication is given can help nurses ensure that medications are given correctly and that errors are prevented. The 5 rights include verifying the right patient, right drug, right route, right time, and right dose. I wanted to provide a quick example of how to give medication using the 5 rights. I chose to use a pediatric example today because pediatric medication errors are known to occur 3 times more often than adult errors. First, I want to verify the right patient. Open-ended questions are important to encourage patient participation and to make sure that you can appropriately verify patient identity against the medical record or the patient armband. So today we have Andrew here who has a fever, and we are going to go in and ask him about his identity. Mr. Andrew, how are you doing today?
Good.
You're doing good? I have some medication here that the doctors asked me to give you for your fever. Can you tell me what your name is?
Andrew Shotwell.
And what's your birthday?
April 1st, 2013.
Good job. Very good. It is completely appropriate to have pediatric patients participate in this part. You can always verify their identity with a parent if they get it wrong, but it's a good way to go ahead and get them included in their patient care. So we verified Andrew's identity by his armband. Second, we want to verify the right drug. In our example today, Andrew has a fever and the doctor wants to give acetaminophen or Tylenol. So I should verify that I have the right drug and the right concentration and that the medication is not expired. So our medication is good to go. Next, we want to verify the right route. So my order today is for acetaminophen 320 milligrams PO once. So this is a one-time order. And in my written order, there's an abbreviation there. The abbreviation PO, of course, we know that that means by mouth. But if you're ever unsure of what an abbreviation means, you should verify with a provider or coworker. So we know that we're going to be giving this medication today orally. Verifying the right time is also important. So for us, we're in an outpatient setting. This is going to be a one-time dose for Drew. So we're going to give this one time and then he's going to be on his way. It's really important for time though when you're talking about inpatient medications because particularly for IV medications, it's important to stay on time because giving medications off schedule could impact the therapeutic effect of some drugs. Finally, I'm going to verify the right dose. With my order, we want to give 320 milligrams, but this Tylenol comes in a concentration of 160 milligrams per 5 mLs. So I know that if I want to give 320 milligrams, then I have to double that dose. So we are going to end up drawing up 10 mLs of medication in order to get the right concentration. Pediatric medications dosing can be variable. So because of their age, their weight, and their body surface area, the dosages for drugs are going to change. And so that is why pediatric medications, especially oral medications, are in a high-risk area or a high-risk category. For us in my organization, we label all pediatric liquid medications as high alert, which gives us that visual reminder that we have to be really careful about dosing. So when we draw up our med, we're gonna make sure that we draw up 10 ml so that we have the right concentration for Drew. So Drew, here's your medication. We're gonna go ahead and give your med. There you go. It's really important that we go ahead and give medications. We don't wanna leave medications on the table for patients to give later, because then we can't really verify whether they've been given or not. And I wanna make sure that I'm documenting appropriately. So I wanna make sure that I'm documenting everything in the right way. Once you become accustomed to using the 5 rights of medication administration, you can quickly verify medications and feel confident that you're giving those medications in a safe way. I hope that this example further explained how you would utilize these rights and that you feel comfortable with our initial objectives of defining medication errors, identifying potential causes of errors, and identifying and applying the 5 rights of medication administration. Thank you for your time and attention today. Please complete the short survey provided and return it to Dr. Joy Kiefer at jkiefer@umo.edu. I'm going to also show you my references for today so that if you want to look up information about this topic, you can do so as well. Thanks again for your attention.